Dr. Don Funk here from Movement Medicine in Montrose, Colorado. I'm a chiropractor that also works in personal training, and I see a lot of people with low back pain. And that low back pain is really interesting, and I'm going to share with you some anatomical facts that'll help you understand your low back pain better. So when we look at that vertebrae, those bones in the low back, if we look at that from the front, what we see is that this is the disc, and these are annular fibers. So they're like the rings on a tree. And the fibers cross like this, like plywood. In plywood, if you tear it apart, there's one grain that goes this way and one grain that goes this way, which makes it incredibly strong. It's the same thing with the disc. In the front of the spine, those are cross-sectioned like this, so they can twist and turn and do a lot of things, and they're quite resilient. However, when we look at the back of the spine, and here's the vertebrae again, here's the disc. Those fibers tend to travel up and down rather than crisscross. That means that these fibers back here are weaker and they tear easier. Like I tell so many of my patients, that lumbar spine is pretty good at bending forward and back. It doesn't like to twist very much. So if we have problems in our pelvis where we're having some hip problems and there's some muscle imbalances, and we're getting kind of that, instead of a nice figure 8 in the gait, we get a little shimmy in that gait. Well, just a little bit of shimmy over a long period of time causes irritation in this disc. And those fibers, instead of going forward, they're twisting a little bit with every step. It doesn't take too many months or years for those fibers to start tearing. And then what happens is we get a tear, and then we get a disc bulge back here. And that disc can then interfere with these nerve roots that are coming down here. And that disc can press against that nerve root and cause all kinds of pain going down the leg. But oftentimes that problem starts with a small tear in the annular fibers of that disc. So it behooves us to keep the biomechanics of the pelvis and the hips working properly so that we don't have that aberrant or unusual movement in the low back. That's what's going to save your low back, is getting those hips strong and flexible. This is Dr. Don from Movement Medicine in Montrose, Colorado. I look forward to seeing you soon. Thanks for watching.